You're here for a fit test? Okay. Sure, I have your papers right here. Okay. Just gonna put the date. If you can confirm your date of birth for me. Okay, I'm just gonna sign off on that. Okay. Just get some sanitizer, okay. Okay, have you been fit tested before? Okay. Okay, so you were small last time. Okay, and have you had any changes, any significant changes in your weight? Oh, okay. You know, I would say that's recent enough that there may not be any changes, but you need another one. Okay. Yeah, we're getting people coming from different departments and saying that they need some during this time. Yes. Okay. Well, then we can go ahead and get started. Let me just get gloves on. You can go ahead and hang up your stuff. Yeah, okay. It does take about 15 minutes, I would say. Yeah, okay. Are you allergic to any artificial sweeteners? Okay. You know, it's just a question that we ask because the solution that we use. Right. I would imagine not. There are a lot of artificial sweeteners in many things these days, but I'm glad that you're not allergic. Okay, so the first thing that we're going to do, I'm going to have you put this hood on. Go ahead and put that on you. Okay. Alright. And so the first thing I'm going to do is spray a sensitivity spray. I'm going to spray it inside the hood that is on your head right now, and I'd like you to inhale through your mouth and tell me if you taste sweet, salty, bitter, or nothing at all. Okay? Alright. I'm going to do 5. If it will work. It's working. Okay. Sometimes they're fickle. Sweet. Perfect. Okay. Then you can go ahead and take the hood off, and I will get a mask for you. We will use it again. Yeah. I'm sorry. I hope that you're not claustrophobic at all. No? Good. Okay, so since you were small last time, I'm going to give you a small this time. Alright, so the first thing that you want to do when you get an N95 mask, make sure it's the right size. They are printed on the box. This is the 1860S, S being for small, and the size is on the front of the mask, and then they are also printed on the box. First thing you want to do when you get a mask is hold it up to the light and make sure that there are no holes, rips, or tears, no places that light can get in, because that might mean that there's a flaw. A little bit of light around the staples is fine, but you want to make sure that there are 4 staples. You want to make sure that it has 2 straps and that they are both attached. And then you want to make sure that this foam piece is here and that this metal piece is here over the nose. The best way to put one of these on is to hold it like this with the straps hanging down, and then put your hand through with your fingertips towards the metal like this. Hold it up to your face, and then the top strap is going to go above above your ears on the crown of your head, and then the bottom strap is going to go up and over your head and all the way down at the base of your neck, okay? So go ahead and try it on. Yep. Okay. I'm sorry, I don't have a mirror in this room to check. Okay, do you feel any pinching, pulling, or pain anywhere? Okay, and the next thing that you want to do is take both hands with your fingertips or your thumbs and mold the metal around your nose nice and snug. Yeah, the reason that you want to avoid using one hand and doing the pinching method is because that can create a gap on the bridge of your nose where air can escape and then air can also get in. And so you want to use both hands with your thumbs or your fingertips. Okay, good. All right, now, okay, go ahead and open and close your mouth just enough to talk. Just drop your jaw, right? Not extreme, not like you're yawning or anything, just to make sure that your chin stays in place, stays inside, and it does. So it seems like a small is a good fit for you, and that's good. And then go ahead and bring your hands around the edges of the mask and take a breath in. Exhale through your mouth. Do you feel any air escaping around the edges of the mask? No? Okay. Yeah, it's okay to feel heat, and it's okay to feel some air coming out of the front because that is the respirator part, and it's okay if you have a gap between the bottom of the mask and your jawline right here. As long as your chin is keeping contact, that's okay. Okay? And are your glasses fogging up at all? No? Okay. Well, since you are as comfortable as you can be in the mask, then OSHA wants you to sit for several minutes in the mask so that you can get comfortable and decide if the mask is acceptable to you. And the seal, the mask creates a seal after 5 minutes. And while we are passing that time, we can go over a few things that we need to say anyway. That is good information for you to know. This test is required by OSHA to be done once a year, and it is good for 1 year. The only reason that you will want to come back before 1 year is up is if you have any facial surgery, dental surgery, anything that will change the shape or contour of your face, gain weight or loss of 10 pounds or more. And then for women who are pregnant, they use a mechanical respirator called the PAPR. And men with facial hair also use the PAPR as well. But every man that I've seen seems to be shaving these days so that they can have an N95. The times that you'll want to wear an N95 is when a patient is in respiratory isolation. That is usually, I believe that is a blue sign, or when there are droplet precautions, such as around flu season, and then as a yellow sign, there's a pink sign. The yellow sign is when there are special pathogens. The N95 filters out 95% of particulates, both large and small, but it does not protect against other chemicals, liquids, oils, or vapors. And so if you walk into a room and you smell something, that's probably okay. You can still be protected. However, if the mask does get wet, you will want to leave the area, leave the room, remove the mask and replace it with a new one using the same procedure that we just did with this one. If you forget what that procedure is, there is, I believe I have a paper. Yes. There are instructions such as this to show you how to don and doff a mask. Okay? And so, if at any time during this fit test you feel dizzy, lightheaded, short of breath, any sort of unwellness, then let me know. We are going to put the hood back on, and so make any adjustments to the mask before you put the hood back on, because if you have the hood on and then you want to touch the mask, then that will void the test and we have to start over again. Lastly, the testing solution that we are going to use is 10 times stronger than the sensitivity solution. So when I sprayed the solution when you had just the hood on and no mask on, and you told me that you tasted sweet, that was the answer that we were looking for. And so that is saccharin. It's the same thing that is in Sweet and Low, and that is why we asked about the allergy to artificial sweeteners. And so like I said, this is 10 times stronger when I'm going to spray when you have the mask and the hood on. And so if you think that you taste any sweetness as we go on with the test, decide if it is fairly mild or it comes and goes, or it's just sometimes, because in that case that may be residue from the sensitivity solution that's lingering on the lips or the back of the throat. However, if it is all of a sudden very strong or it builds up, then you may have a leak in your mask, and then we will reconsider from there. If you think that you taste something sweet but you are unsure which one it is, if it's residue or not, then there is a litmus test we can do at the end, and that is that we are done spraying, and you will keep the hood on, you will reach up under the hood and then pull the mask from the bottom so that you have a gap under your chin. Pull the mask out from the bottom, take a breath in through your mouth, and then you will be able to taste what I have been spraying in there. And as long as you haven't tasted anything that strong, then you will have passed and you will be fit. Do you have any questions before we start? No? I can hear you just fine. It's okay. The mask doesn't muffle your voice all that much. Yeah, so there are 7 parts to this test, and each one is 1 minute long. I'm going to start out with 10 sprays in the hood, and then I'm going to do 5 sprays every 30 seconds. And we will go on like that for each step. So the first step is normal breathing through your mouth, because again we're looking for taste rather than smell. Yeah, to make sure that it's working. And then the second test is deep breathing, again through your mouth, a few deep breaths, and then a few regular breaths in between every 2 or 3 to make sure that you don't get overwhelmed. The third is turning your head side to side, again breathing through your mouth. You can inhale in center and exhale over your shoulder as if you were calling out for help or speaking to someone. And also, to get the range of motion, you can stretch your neck if you like. The fourth is moving your head up and down, and so you can inhale, look up, exhale, look down. In case that you think that the hood is moving too much when you're doing these head motions, there is a place in the collar to hang on to it, to hold it in place. The fifth is a talking step, and that is you can talk out loud, tell me about your day, although I can't talk back. You can do ABC, 1, 2, 3, do a different language if you know it, sing a song, tell me everything that you ate today. Some people, they are just finishing, and some people, they are just coming in, and so some people have less things to say. That's up to you. And do that for 1 minute. Do each of these steps for a full minute. Don't just do a couple rounds of, turning your head and then stop. You have to do each one for the full minute to make sure that the mask is fit right. and withstanding all of the motions. The sixth step is moving around and doing any motions that you may do in your regular day. And so depending on what department you're in, that may be sitting down sometimes, it may be walking quite a bit, it may be turning and talking, it may be bending down. If you do bend over, then make sure to hang on to the hood so that it doesn't fall off your head, because if it does come off, then we'll have to start over. And then lastly, the last step, the seventh one, is normal breathing again through your mouth. If at any time during any of these steps you think that you taste something sweet, go ahead and let me know. And then we will decide what you may or may not be tasting, if it's, like I said, if it's that really strong solution. Right. Okay. So, any more questions? No? Okay, you can go ahead and when you are ready, go ahead and make any adjustments to the mask that you may need to, and then go ahead and put the hood back on. Yeah, I can help you. It's fine. Okay. Ready? Okay, so this is 10 times stronger, and like I said, I'm going to do 10 sprays at first. And then we're going to do 5 sprays every 30 seconds. Alright, 10 right now. And this is just normal breathing through your mouth. It's not rude, nobody can see you. And 5 more. Halfway through this one, yep. Still normal breathing through your mouth. And in about 15 seconds, you're going to switch to deep breathing. Again, a few slow, deep breaths and a few regular breaths in between. You can go ahead and start that now. Yes, through your mouth. Any changes so far? Are you tasting anything? No? Okay. We are still deep breathing. Okay, in about 15 seconds, you are going to go to the third step, and that is turning your head side to side. Again, exhale over your shoulder as if you were speaking to someone, nice and slow. Don't want to get dizzy. You can go ahead and start that now. Halfway through this one. Okay, in about 15 seconds, you're going to switch to head nodding. Nice and slow. Again, inhale, look up, exhale, look down. Go ahead and start that now. sweet it is. Right. That makes sense, yeah. You're halfway through this one, you're still nodding. Right. So I think if there was a leak, then it would, you would be getting something all of a sudden, like every time that I spray in there. Okay, 10 more seconds of this, and then you'll switch to talking. You do the talking. I'm just going to listen. Again, tell me about your day. 1, 2, 3, ABC. Some people sing songs. Mm-hmm. Mm-hmm. Keep going. I'm still listening. I'm going to use my other hand. This hand can sometimes get tired. Okay, now you're going to be moving around. Yep, doing any movements that you might do in your typical day at work or when you would be wearing a mask. Yeah, there are some people that a lot of their work is sitting down and being at a computer, and I think that's yeah, it can get tiring. Okay, off you go. Ten more seconds, and then I'll have you come back. And then this will be the last step. And that is normal breathing again through your mouth. You've been breathing through your mouth this whole time, right? Good, okay. And have there been any changes throughout this time? No? Okay. Okay. And 30 more seconds left. And we will go ahead and finish the minute. I'm going to start with your paperwork. Okay, so you had a small, and today's date, and my signature. There are 2 forms here that you'll need to sign when you are done. Okay, so the 7 minutes are up, and you can go ahead and reach under and pull the mask out from the bottom. Take a breath in. Yep. Yes, it's very sweet. Okay, so as long as you haven't been tasting anything like that, then you passed. So you can go ahead and take the hood off, and I will take that. Thank you. And I will clean it for the next person. Yeah, if it kind of smelled funny, those are Oxivir wipes, and so it's very clean. However, it smells kind of like a porta potty. I'm sorry, but smells are okay. Yeah, smelling things are fine. Tasting things is not okay with the mask on, right? Okay, so the proper way to take a mask off is to touch only the straps, and so take this top. So take the bottom strap off first, and then the top strap, and then pull it away from your face. Okay, and then it's okay this time to touch the respirator part. I'm just getting a marker. It's okay this time to touch the respirator part. But other times when you have worn it and been in the room with a patient in respiratory isolation, then do not touch the front part. I'm just going to get a sticker, and I'm writing your name and also your PIN, or sorry, your ID number, so that you can put this with it. And actually, I'm out of bags. I'm sorry, we did have paper bags for you guys to take them with you, but otherwise this one is for you to take with you, and you can use it later today, later in the week. And so go ahead and take this form. So this form is going to stay with us. So just go ahead and sign, and the date. Okay, great. And then this form you will take with you, and it just shows that you are a size small. Yep, go ahead and date that one too. And that one you can give to your supervisor. And great. And so if you forget what size you are, then it's going to be in your record, and it will be in our computers. And otherwise, if there are no more questions, then you are all set. You are good to go. Okay, I'm glad I could help you today. You have a good day.